Hiya team! It's Good to Know Wednesday. Our topic today is CVC Lumens. CVC Lumens are described as the proximal, medial, and distal. They are color-coded. Proximal is white, distal is brown, and medial is blue and gray. The distal lumen is located at the very tip of the catheter. It is the largest lumen with a 16-gauge size and is the most secured lumen. The distal lumen or brown port is used in CBP monitoring because it is closest to the heart, whilst the proximal and medial lumens are known to show inaccurate waveforms. We also make sure that we attach our emergency ports in the distal lumen so that any life-saving IV drugs will be delivered to the biggest lumen. The maintenance line is also attached here so that we can easily give bolus fluids if required without interfering with other IV drugs from other lumens. And if there are no other lumens available, intermittent IV drugs can be given through this lumen. Being the largest lumen, it is a good practice to give blood products through this port, and if there is no arterial line, the distal lumen should be used for blood collection. The distal lumen is also where we attach the injectate thermistor for transpulmonary thermodilution. Therefore, we need to ensure that there is another three-way tap that serves as an emergency port. Whilst the medial lumen can be found 2 cm away from the tip of the catheter. If the CVC is quad lumen, there is an additional medial lumen with a 14-gauge size. This gray lumen is a rapid injector of 10 mL per second. It is the lumen best used for CT to accommodate faster contrast injection. Both the proximal and distal blue port have an 18-gauge lumen. The medial lumen is considered to be the second most secured lumen. It is ideal for vasoactive medications whilst taking note of drug compatibilities. The proximal lumen is located closest to the skin, hence we do not give boluses in this port, and we should not give inotropes or vasopressors due to the increased risk of extravasation. Any other IV infusion can be given through this lumen. And that's all for now. Ciao!